eating, sleeping, showering, having sex. Do these actions sound familiar? To the majority of people, these are just normal occurrences in their lives. Regardless of race, religion, political beliefs, and even age, sex is happening, and it has been since Adam and Eve. And without sex, none of us would be here today. However, as society has changed, so has the act of sex. It's no longer just about creation of life, but also about pleasure. And that's where the need for birth control has stemmed from. Now, imagine not being able to have sex without there being a 100% chance of pregnancy. That's like saying to a woman, you have absolutely no chance at having an education, a career, or a choice in when you want to have kids. As a woman of faith and a college student, I'm always hearing about how birth control may be a sin, because to some, they feel that it's a gift from the devil because it supposedly goes ahead and promotes sex. And yet, through my education, I've come to really appreciate how birth control provides a choice for women. Having said that, through my research, I've found that the World Health Organization states 1,000 women die every day from pregnancy and childbirth. And so the creation of birth control goes ahead and gives those women the choice of if they're going to be sexually active before marriage, when and if they're going to have kids, and just family planning in general. According to J. Key's book, America and the Pill, History of Promise, Peril, and Liberation, the pill's crowning glory was that it enabled women to escape the physical depletion of continual childbearing, plan their births, and pursue educational and occupational opportunities. Contraception that was effective, detached from sex, and did not require a man's cooperation or knowledge was truly revolutionary. With the creation of the pill, soon followed multiple ways of birth control. Batar and Sivan go ahead and discuss in their book Mechanical Barrier Contraception the various types of contraception. The 2 decades following the introduction of IUDs and OCs went ahead and just proved the depletion of desire for condoms, diaphragms, and cervical caps, as they quickly became less popular. However, birth control is not only for preventing pregnancy, but it also goes ahead and helps reduce the symptoms that many women face from various illnesses. Such illnesses go ahead and include irregular periods. According to WebMD, you may have an irregular menstrual cycle if you go ahead and suffer from the days between your periods changing, a heavier or littler flow of blood, and a change in the amount of time you have your period. Also, according to WebMD, the treatment for an irregular menstrual cycle is chosen based upon your desire to have kids and just from every woman to woman. However, symptoms may go ahead and also include irregular bleeding and hormone discrepancies. Therefore, different ways to go ahead and treat this irregularity stems exactly from birth control and goes ahead and can include surgery, changes in lifestyles, exercise, and hormone treatments. However, if those hormone treatments weren't to work, what else would there be? More extreme need is the factor of polycystic ovarian disease, which, as well as hypo-overactive thyroidic disease, is stemmed by an irregular menstrual cycle and can be treated with either hormonal therapy or birth control. However, if that hormonal therapy was not to work and birth control wasn't available, women may continue to suffer the effects and would possibly never be able to have children in the future. As a woman of faith and just general beliefs, I am plagued by the arguments about birth control. And I feel that due to it not only preventing pregnancy, but because of the relievement of health issues, that the argument of whether it's a sin or not is completely irrelevant. I feel that any woman, regardless of her race, political beliefs, religion, social standing, whatever be it, should have an opportunity to go ahead and gain birth control if she does so wish. I also feel that any woman who does decide to use birth control should not be discriminated against for that choice. And, well, who knows? Maybe someday society will realize that a woman's choice of whether or not to take birth control is her business and not theirs.